Have you ever been depressed? If you answered yes to this question, you are not alone. According to an article in Health and Medicine Week, over 19 million Americans suffer from depression. In addition to this staggering number, there are many cases that often go untreated and undiagnosed. And because of this, you or someone you know may have experienced depression in the past or is experiencing it right now. I was one of those people. I suffered from depression for years before I realized I had a problem and was properly diagnosed. And today, I'm here to heighten your awareness of this often debilitating disease. I will identify the symptoms of depression, explore possible causes, and finally, convey the treatment options available. Now, what are the symptoms of depression? Depression isn't just feeling sad or lonely sometimes. According to Relay Clinical Education, symptoms may include lack of sleep or sleeping too much, changes in appetite, changes in energy level, a loss of sexual desire, feelings of worthlessness and guilt, and thoughts of suicide and death. Not only can depression affect us emotionally, studies have shown that it affects us physically as well. Mental Health Weekly states that symptoms can also include headaches, back pain, joint and muscle pain, and even dizziness. So now that we've looked at the symptoms, let's explore the causes. Heredity plays a major role in causing depression. Rita Shore, an author in Business and Health, states that children who have at least one depressive parent have a 1 in 7 chance in experiencing depression. And Harvard's Special Health Report says that people who have a first-degree relative that have experienced major depression have a 1.5 to 3% higher than normal risk of experiencing that condition themselves. Heart disease and diabetes have also been linked to depression. According to Harvard Health Commentaries, people who have had a heart attack, have heart failure, or have another blood vessel or heart disease are more likely to experience depression than people who don't have this disease. And Sean Roberts of Diabetes Forecast says that having diabetes doubles the risk of experiencing depression. Other causes may include the loss of a loved one, using alcohol and drugs, experiencing a high amount of stress, a recent change or development in your life, and recently giving birth. So we've looked at the symptoms, we've looked at the causes. Now, what treatment options are available? A combination of drug therapy and psychotherapy is the accepted method of most health professionals. However, studies have proven that exercise can be just as effective. In an article in Mind, Mood, and Memory, 45% of people who used exercise, as opposed to the 47% that used antidepressants, achieved remission. And in addition to exercise, having a supportive friend has also been proven to help overcome depression. In prevention, a study of a control group of women, 65% of those women who talked to a friend at least 1 hour every week experienced remission as well. That is the same success rate as if they were taking an antidepressant. Now I hope I've shed some light on you on depression and helped you to recognize it and know of ways to overcome it. Just to give a brief recap, emotional and physical symptoms can include sadness, feelings of worthlessness, headache, back pain, and dizziness. Heart disease, diabetes, and having an immediate family member who has depression increases your risk of depression. And finally, in addition to drug therapy and psychotherapy, exercise and having a supportive friend are valuable treatment options. Knowing all this information could possibly save a life.